My father was a professor of medicine at the University of Pavia, and he advised me to go to this university, the School of Dentistry of Rome, the second university, with Professor Martignoni. That was a good experience because Professor Martignoni taught me a lot and was a very great teacher. He had a very good laboratory, the best in Europe at that time. Then my second big experience was to be with the Professor Massimo Simeon in the University of Milan, the San Raffaele Hospital. Then a lot of our experience in USA, in Italy. In reality, it's 30 years that I'm experienced on this, and now it's already for 50 years that we do implantology. It means we put a screw in the bone to replace the root of the tooth. Then over this screw we build the tooth. Not always we have enough bone to put the screw, so we need to rebuild the bone. There are different techniques to grow the bone. You can make split crest, as you say. This means that you have opened the bone to enlarge, to make an augmentation of the bone. You have to create a structure under the mucosa where you put some bone and you protect this bone. This is a demineralized bone, and you protect with the membrane. This is a tissue of collagen or other substance. The aim of this kind of surgery is to avoid that volume that you create with the bone that you put will be habitated from your own bone, will be built from the cell of your bone. The bone is a live tissue that can grow. But if you don't protect this bone that you put with the membrane, the risk is that the soft tissue, the gum, the mucosa that you put over will grow at the place of this bone. So the difficulties is to build this structure in little space in a precise position. That's why we always use this lens. We need to have always lens to magnify the vision, and in this way we can grow the bone. Today the problem is the biggest problem after implantology is peri-implantitis. Also the implant can have disease, not just the teeth. The implant is a screw, is a metal, is a titanium. That cannot ruin. But the bone around the titanium can have a disease. Why? If you don't have enough bone where you put the implant, if the bone is not enough thick, the risk is that this reabsorb, and because the surface of this implant is rough, easily collect plaque and bacteria who gives disease to the bone and the gum, and you lose the implant. So it's important that the implantologist know well how to reproduce bone.